Hi everyone, I'm Emily and I'm an FY1 doctor at Salford Royal Hospital in Greater Manchester. I trained at Nottingham Medical School and moved to Manchester last August to start as an F1. I started my F1 year on orthogeriatrics with medical on-calls, which I loved because I worked within a fab team and also made some great FY1 friends. Then I moved on to renal medicine and I was due to move on to urology in April, but that has been suspended due to COVID-19. This podcast will just be some informal advice about starting F1, and I hope that you find it useful. I am definitely not an expert on being an F1, and all views and opinions are my own, but I hope that you can take something from this either way. Please have the UK Foundation Programme 2020 allocations to Interim F1 posts in England document open on your phone or laptop, as I will refer to this a few times. I think that this has been emailed to you or may be available on Oriel. Before we start, I just want to say a massive congratulations. You should all be so proud of yourselves for all of your achievements and hard work throughout medical school. Most of you have done your finals and of course the PSA and the SJT, and you should be feeling so proud and relieved. But these are probably not the first emotions that come to mind with all of the uncertainty and anxiety which now surrounds us due to the COVID-19 pandemic. For those of you at medical schools who haven't been able to do your finals and will be graduated automatically, I'm sure that sounded great at first, but the reality might be that you feel that you finished medical school with an anticlimax and without the same sense of achievement. For those of you who've already done your finals and were meant to be doing an assistantship placement or even your elective, I am so sorry that you've had to miss out on these opportunities. My elective was this time last year, and I've had several discussions over the past few weeks with colleagues about how heartbreaking it is that you guys have had to miss out on this opportunity, and we really do feel for you. So, as if that wasn't enough to cope with, you've also been asked to start as an F1 early. When everyone else's life is on hold, for example, people have had to cancel their weddings, doctors in training can't do their exams, etc., your life is on fast forward, and you've been asked to start as an F1 doctor in approximately April rather than August. So, with this in mind, I wanted to have a chat about what this might be like and try to give you some top tips and reassure you. I've had a read of the BMA guidelines and also the UK Foundation Programme document that I mentioned earlier, and wanted to go through it and give some advice from both myself and my colleagues in the hope to try and clear up some anxiety, questions and concerns. I wanted to start by telling you what it is like to work in the NHS at the moment. The coronavirus crisis is an unprecedented time for the entire world, and for the UK specifically, it is a unique and totally bonkers time for the government, our education system, and also our healthcare system, as you already know. You may have read a few articles from NHS workers over the past few weeks regarding the anxiety around the PPE equipment that we have been provided with. There's no point me telling you the current PPE guidelines, as it is changing so regularly that it would surely be out of date by the time you're listening to this. But PPE and the safety and well-being of the NHS staff has been and is a real concern for many people working within the hospital, and everyone will have their own personal concerns regarding COVID-19, such as their own health or their friends' and family's health. But what I can tell you from my experiences so far of working in NHS is that everyone is working together in unison during this difficult time. Everyone is looking out for each other and understands that their colleagues will have concerns which are individual to them. We have pulled together as such a strong team, and each day several people ask me how I am, and I ask them the same, and this opens a platform to share our experiences, good or bad. There is also still a lot of humour within the hospital as everyone tries to cheer each other up, and lots of treats and snacks dotted around, and I can honestly say that I am proud to work for the NHS right now. I promise you it's not all doom and gloom. You will be working in a multidisciplinary team, but many of your colleagues, including your supervisors, will be medics. Just remember why those people went into that career, because as this crisis has shown, it definitely wasn't for the money, so you will be working alongside genuinely nice people. So if we work through the UK Foundation Programme document, it states that those final year medical students who have volunteered to start as interim F1s will be able to choose to work in a trust near their medical school or their new trust that they would be starting in August. Now, your preference on this will depend on lots of things such as housing, finances, or maybe one of the most important things to consider is where you'll have the best support network. So some of you may choose to stay in your medical school trust, as this will come with some familiarity, in that you'll be working in a trust where you'll be familiar with the computer systems, the hospital itself, and will hopefully be working with some friendly faces. So it might feel a little bit like a paid assistantship placement. Or alternatively, if the trust that you are planning to move to is closer to friends, family, or your partner, then you might feel that starting in a new trust would suit you better. So it really is an individual choice, and one way to work through this might be to do a pros and cons list of each. The guidance clearly states that you will need to receive a full induction and supervision. This is great and exactly how it should be, as it means that you'll be starting work in a protected and supported environment, like all FY1s should do, coronavirus or not. The hospital must offer at least half a day of induction, which is a shorter amount of time than your predecessors will have received. The induction will likely cover an introduction to the hospital, the key areas of the hospital to be aware of, how the computer systems work, etc., etc. All of these things will be helpful to go through, but they are likely things that you will pick up on once you actually have started working and using those softwares, etc. Our induction also included a quick BLS or ILS recap, which you may or may not have, depending on whether you were part of the crash team or not as interim F1s. You will probably also have a specific induction session in regards to COVID-19, the current guidance, and the way that your hospital is structuring its A&E wards and the staffing, and what they expect your role to be in the midst of all this. Now I'm going to go through the roles and responsibilities of interim F1s, which is at the bottom of page 4 in the document. The skills listed are skills that you would have had a chance to practice on your assistantship placements. So I'm going to go through each one and give some tips and advice from my experiences. So it says interim F1s will be able to undertake the following supervised tasks as part of a recognised clinical team. Number 1 is note-taking. So you may or may not have done this before, and depending on where you work, this may be paper notes or an electronic system. Either way, try to make your notes clear and concise. Start with the date, time, and the consultant or registrar who is doing the ward round. It is likely to depend on the preferences of your senior as to how they want you to structure the notes, and how much or how little detail they want you to include. But one way to structure it might be to start with the date and time, then write the presenting complaint or their inpatient management, then any important or significant past medical history. Then you could include some important and relevant new investigation results, and then how the patient is currently, including their new score and their examination findings. What information was given to the patient, and then finally the plan. Usually the best way to structure the plan is a numbered list. And remember that you will need to execute the plan, so if you have any questions, then ask your supervisor at the time. It can be difficult, particularly under the time pressure circumstances, but try not to let your senior move to a new patient until you finish writing for the current patient. They should not do this anyway, but sometimes they may forget that you are not an octopus if they are thinking about the meeting or clinic that they are going to after the ward round. But an extra 5 minutes of their time whilst they wait for you will mean that the plan will actually get done. One useful thing to bear in mind is once you finish your documentation, ask yourself whether you would have a clear picture of this patient and their current management plan if you saw this patient for the first time during an on-call shift. If not, then you need to go back and add some more detail. Remember to also write yourself a clear jobs list, as by the end of the ward round you will definitely have forgotten the jobs for all of the patients that you've seen. So number 2 on the list is ordering investigations. So again, this will obviously depend on the trust that you are working with, but try to watch someone order investigations in your first few days to see A, how they do it, and B, what kind of information they include, such as when ordering CT scans. Again, this will come from ensuring that you are totally clear with the plan from the ward round, and you need to specifically ask what the reason for the CT scan or MRI scan is, etc., when your senior has asked you to do so. Number 3 is procedures, so venipuncture and cannulation. These are skills that you may or may not be confident in. Ask someone to show you the equipment that your trust uses and have a play around so that you feel comfortable with it. Consider watching a video online of these procedures if you feel a bit rusty, such as one of the Geeky Medics videos. Then when you start at work, just try your best and give it a go. If you fail to take blood or insert a cannula after a couple of attempts, then don't worry. Someone else will be able to try. I would recommend going to watch them try the same blood or cannula if you failed, because then you will see what techniques they use. You will find that your skills will improve massively in a short amount of time due to lots of practice. So number 4 is supervised prescribing. Most of you will have passed the PSA by now. Again, doing the actual prescription will depend on the trust, as some of you will be doing paper prescribing and others will do it online. Don't rush prescribing no matter what is going on around you. Use the resources available to you. The BNF app, your trust intranet and guidelines, other doctors, and of course pharmacists. Pharmacists will become your best friends. Then number 5 is completion of discharge summaries. This is again something that you may or may not have done, depending on if you've done an assistantship placement. The key bits to cover are what brought this patient into hospital and what the inpatient management was. Some patients will have had loads of issues or diagnoses during their admission, so it might be worth documenting them in a numbered list, such as 1. Urosepsis, treated with IV antibiotics, 2. AKI, secondary to hypovolemia and sepsis, 3. Delirium on a background of dementia. This will make a long admission clear to the GP or to the clerking doctor if this patient comes back to hospital in the future. You may also want to include their past medical history, any relevant test results from their admission, medication changes on discharge compared to their admission meds, and any follow-up that is required. Discharge summaries are not a very exciting task, but they are more vital than ever when we're trying to get patients home in the current crisis. And I would like to add a number 6 to this list, which is completing a full 8 or 9 hour day on the ward, because it is tiring. It sounds silly, but until my assistantship placement, I don't think I'd ever spent a full day on the ward, because it was usually broken up with teaching or a clinic. But you'll soon get into the routine of doing the ward round and then starting with the jobs. The guidance also makes it very clear that you will have a clinical supervisor and a foundation year buddy. They will be happy to help and answer any questions or concerns you may have, so utilise them. It may be useful to arrange to meet them for lunch or coffee in the first week to smooth the transition into work. Last of all, I want to give you some top tips and advice for either starting as an interim F1 or as an FY1 in August. They may sound simple, but they are vital, and at some point you will forget them. Approach every patient with an A to E structure. Even if they are not acutely unwell, it is a logical and structured way to approach the situation, and it means that if you need to discuss them with a colleague or a senior, then you'll present it in a logical way. You may even want to start your documentation by writing A to E down the side of the page. You can always ask for help. I honestly cannot stress that enough. There is always someone who will be senior to you, who you can discuss a patient with if you are unsure and need some guidance. Everyone has been an F1 and they know how daunting or scary assessing patients can be. If you don't know or you aren't sure, then you have a duty of care to ask for help. It is likely that your registrar will know the answer immediately because they have so much knowledge and experience, so don't stress about asking what you may think is a silly question. They would rather that you ask. Just try to get the story straight in your head before you ring them, so that you can give them a clear SVAR handover. Jotting down the important information is a good way to do this. Never let yourself feel stranded or alone with a problem. You are part of a much wider team who will always help. And another tip that someone gave to me is that if you don't feel that you have time to look in the guidelines, then you definitely shouldn't be handling the situation on your own. If you're seeing a patient and you don't feel that you have time to step away and go to read up, then you need senior help there. So ask for it. This next one is going to sound simple, but it is so important. You need to eat and drink plenty whilst you're at work. No one wants a doctor who is dehydrated or hypoglycemic to look after them, as it is likely that your decision making won't be as good. You need to look after yourself in order to look after others. I guarantee you'll forget this at some point, but try not to. Take a bottle of water onto the wards with you and leave it in a safe place, such as the doctor's office. Try to take your lunch breaks off the ward whenever possible, because it will give you some proper headspace and it will feel more refreshing than if you eat your lunch in the ward staff room. For those of you who will be moving to a new trust, either as an interim F1 or as an FY1 in August, you may be worried about meeting new people. Each trust usually sets up its own Facebook page for the new F1s, which is a great way to get to know people that you're going to be working with. You'll also be able to bounce ideas off with people, such as housing recommendations with people who are familiar to the area, and they can often give you pros and cons of each area to live and the commutes. Then as soon as you start, it's like that your FY1 cohort will start a WhatsApp group. And it really is like freshers. The vast majority of people are lovely and will be really keen to make new friends. When you're not at work, enjoy yourself. You need to switch off from work, and obviously a lot of people will usually do this by playing sports, seeing friends and family, etc. And at present with lockdown, that isn't possible, which is really, really difficult. But try to find other ways to do this. Walk or run, do a home workout, pick up a new hobby which you haven't had time to do before, like learning a new language or cross-stitching or whatever takes your fancy. And pick up the phone. Speak to your friends and family, as having a strong support network is key. I hope that you can take something from this podcast and can apply some of these tips when you start work in the next few weeks or months. No matter what, don't forget to look after yourself and reach out and ask for help when you're struggling. I wish you the best of luck when you start your new careers in this very unique time, and I am sure that you'll be a credit to yourself, your families, and your medical school.